Have you had the spit test yet? Have you heard of this screening test, which is a saliva test, but we call it the spit test because it's as simple as spitting in a tube. With the information you glean from the spit test, you can know if your body is at risk for certain diseases and or if you have diseases in your body at the present time. First and foremost, did you know that 80% of people in the United States have gum disease? Some form of inflammation in the mouth, and you may even look great when you go to the dentist for evaluation. You may look great in the mirror. You may like your smile and your breath may be good, but you can have bacteria and other pathogens or microorganisms lurking and living in your mouth and oftentimes underneath the gums where you don't see it and you aren't aware they're there unless you test your saliva. So besides the fact that this test is valuable and oftentimes overlooked, let me tell you what else you can know about what's going on inside your body. 50% of people who have heart attacks, the heart attacks are triggered by one of these bacteria or pathogens in the mouth. So if you don't test, you don't know. 70% of people that will go on to develop Alzheimer's disease and other types of dementia have these bacteria in their mouth. You have a 50% increased risk of developing cancer. And did you know if you have diabetes, 85% of the individuals with diabetes are likely to have these bacteria in their mouth or what we call an altered oral microbiome. The health of your mouth is not ideal. Again, even if it looks okay, even if your breath is okay, you may have these pathogens in your mouth, and the only way to know is to spit in a tube and have it analyzed. But if you're diabetic and you have one of these pathogens or more in your mouth, left untreated, it's more difficult to control your blood sugar and more difficult to achieve the health that you want. Periodontal disease and gum disease are the most underdiagnosed, undiagnosed, and undertreated disease out there. And as I said, many of us have gum disease and periodontal disease, 85% of us. So an easy way to know where you stand, regardless of your checks at the dental office, regardless of how happy you are or are not, with your smile, with your breath, with the way your gums look, everyone needs to have the spit test. Why do I say that everyone needs to have the spit test done? Well, I'm Dr. Gina Pritchard, and in my practice in Frisco, Texas, my main goal is to help people live a life free of heart attack, stroke, diabetes, and dementia. And based on the statistics I just gave you, of course, I cannot ensure that someone has a great evaluation and a great care plan and is protected from these terrible diseases unless I understand the health of their mouth by getting a saliva test, having them spit in a tube. It's so easy. And so I recommend everyone have this test done because we want to know as early as possible if you have these bacteria lurking so that you can live the life that you want. But let me give you some examples of why you want to consider getting this test done. First and foremost, if you've had a dental procedure or you have a dental procedure coming up, meaning braces, you've had teeth pulled or a tooth pulled, or you have plans for one coming up. If you've had root canals or you have root canals planned in the future, and if you've had implants, all of these dental procedures are more likely to be successful initially and long-term if you know about the health of your mouth with a saliva test. If you are at risk for cardiovascular disease, if you want to know if you're at risk for cardiovascular disease, heart attack, stroke, dementia, vascular-related dementia, etc., or certainly if you have those diseases and others, which I'll mention in just a minute, then you want to have this test done because it may be the one thing that is keeping you from achieving the health that you really want, keeping you from feeling your best. Certainly any inflammation that's shown up in your blood work or any inflammation in the body, if you have an autoimmune disease or gastric distress, the list goes on and on. So if you have or at risk for hypertension, coronary artery disease, cardiovascular disease, heart attack or stroke, if you have diabetes, if you have dementia, early stage cognitive decline, early stages in the way that your brain functions, meaning it's not functioning as well as you'd like it to, or if you have dementia or a loved one has dementia, you still want to get these pathogens because it's highly important part of the care plan for somebody who is already experiencing dementia or Alzheimer's disease. You want to get this test if you have hypertension. I didn't mention that in depth earlier, but it is just like it's difficult to control your blood sugar if you have diabetes and you don't know about the health of your mouth with the saliva test. It's difficult to control blood pressure if you don't know about the health of your mouth with the information you glean from the saliva test. And then lastly, I'll say you also want to get this screening test done if you're pregnant or if you're in your pre-pregnancy planning stages. If you plan to be pregnant in the future, this is an important test for both partners to have run and know where you stand in terms of bacteria, viruses, yeast, and healthy bacteria in the oral cavity in your mouth. So I recommend that everyone get the spit test, the saliva test, as easy as spitting in a tube. So order your spit test, your saliva test today, and when you get your results, we'll ensure that you have the information that you need to understand what it means for you and your health today and your future health. We'll ensure that you get the information to understand what it means for you and how to achieve the health of your dreams.